Good evening, good morning, good afternoon. Hello, everyone. Before before I introduce Wayland and started the presentation, I want to share a few very specific numbers with everyone. So between, let's say, in China and US, we have a very similar average life expectancy. But the Medicare expense in China is only 7% of the GDP. Comparing US has the 16 to 17% in expense in the Medicare. So the one of the reason the difference between China and US is that in China most of the uh, healthcare providers the public healthcare systems. So the public hospitals in China, the size is differently from any country in the world. So with a 1,000 beds hospital, we consider this as a normal or small hospitals. The biggest one in China, the public hospital has more than 10,000 beds in one hospital. So one of the reasons that the public healthcare system in China is that very high efficiency is that we uh, Lean Enterprise China already promoting and coaching the public hospital to implementing Lean for more than 13 years. And the one who is leading this Lean Healthcare in China is William Luo. He's the director of Lean Healthcare, Lean Enterprise China. So he will bring us a very amazing and impressive sharing of his Lean journey in China for more than 13 years. Let's welcome William.
Thank you, King. Hello, everyone. So glad to be here to share with you Lean Healthcare in China. Actually, the subtitle is from improvement projects to Lean departments. Maybe you will be curious about what is it. So I would like to share with you this. So my name is William Luo, and also you can call me Norway in the pronunciation of Chinese. I'm the Lean Healthcare Managing Director at Lean Enterprise China. So when we talk about Lean healthcare in China, or when we talk about Lean in hospitals, what are we talking about? As a Lean practitioner or as a Lean expert, every time when we talk about Lean, we may say Lean is good, Lean is scientific methodology, Lean is approved management, thinking about continuous improvement. Lean is about behavior change, Lean is about a culture change, Lean is about transformation, something like that. In one sentence, Lean is good. You should try this. But as a leaders in the hospital, maybe they don't think like that. The first question maybe came to their mind is how can Lean help to save patients? How can Lean improve patients' experience? How can Lean help to improve the operational efficiency? And also most of the leaders may think even though you have implemented Lean in many hospitals, but our hospital is special. So how can you prove it in our hospital? Or someone may say, we have a lot of professionals, we have doctors, we have nurses, we have a lot of guys. They are very busy on their daily work. So can you guys do it for us? So you can say that it's totally different understanding of Lean or whatever continuous improvement or Six Sigma, something like that. So the biggest challenge for us actually is how to convince the leaders in the hospitals to convince them Lean is good. Lean is valuable for the patients, for the caregivers, for the hospitals, and also Lean can be implemented in hospitals, in their own hospitals. So how to do it? There's a book I would like to share with you or recommend you a book. It starts with Why, written by Simon Sinek. So in this book, the writer found that many people, many people, including leaders, managers, they may think they when they make the decision to change their own behavior or change their own mind decision, they start off what we need to understand what is it, and then we need to understand how to do it, and then we need to understand what's value equal to why we should do it. That's many people think about it, but the writer of this book started with why. He found that actually many leaders and managers, when they make decision, they start with why. So they first of all, they need to understand why do we need lean in our hospital. And then they got to be interested in lean healthcare. Then would like to know how to do it in their hospital. And then they would like to know what is it, what is the path, what is the routine about that. So how to start with why? That's question. So that's also my first question to answer. In the book of Heart of Change, written by John Kotter, actually, he is a professor in Harvard Business School. So in this book, Professor Kotter found that many executive leaders, they may think when they make the decision to change their own behavior or change their people's behavior for some professionals, they may analyze the data and think about it, give themselves a very solid reason to change and then change. This sounds reasonable. But after study of hundreds of organizations about change management, Professor Kotter found that the moment when people to make this decision to change is totally not about reasonable. It's more efficient. People need to see it, need to witness it, and then feel it, feel the emergency to change, and then they will change. So let me give you two cases. The case one, this hospital actually right now we have cooperated around 3 years. But maybe 4 or 5 years ago, the CEO of this hospital didn't start this lean journey until he visited 2 hospitals and saw the result. So at the beginning, the CEO reached me and invited me to share what the lean healthcare for his whole middle management team around 200 people. So I go to the hospital and did a speech around 2 hours to share with those 200 middle management teams. And I talk with them what is lean healthcare and I show them the examples, the case, the projects, the improvement projects we have made in other hospitals, and to let them know how can lean help them to improve the patient's experience, to improve the quality and safety and also the operational efficiency, but they didn't start it. They may think, okay, it sounds good, but does it matter with me? So when the CEO, after 1 year, the CEO invited me again to help to organize a trip to 2 hospitals in Shenzhen. So for those 2 hospitals, they have implemented lean around 3 years by that time. So when the CEO and the leaders heard the leaders and managers from other hospitals who have applied lean for 3 years, they heard their feelings, they have saw the results, and then they start to believe, okay, we need to try it. Then they start the lean journey in 1 month. Case 2, in one of the hospital, in case 1, the directors, they have implemented lean for 1 year, and we have become friends. So they told me, William, actually, we didn't believe in lean and your team at all at the beginning until we saw the results of the projects after 1 year. So you can see if they cannot experience it, and if they cannot see it, usually they cannot really start to change. Because lean is not necessary, it's not the fundamental of the hospital. They can still run the hospital by themselves without lean. So how to do it in the hospital? That's the second question. First, why, and then how. So based on our experience during the past years, we implement lean in hospitals helped in 3 steps. Step 1, we use these improvement projects to answer why, to let them know, let them see, let them experience, let them witness why lean is helpful, is valuable for us, for the patients, for the hospital. So we developed kind of lean we call it Lean Healthcare Green Belt People Development Program to enhance the problem-solving skills with Lean Think, with workshops, tests, on-site coaching, and assessment. Then certificate, Lean Healthcare Green Belt certificate. So we don't focus on the tools about the value stream mapping, S3, and also the talk time, something like that. But we focus on the pain points. The pain points they are facing. So if they got the pain point, we can teach them and we help the hospital to develop their own talents, to help them use Lean thinking to solve their own pain points, so that they can feel it. Okay, really, Lean can help us. So let me show you 3 projects. Project 1, reduce waste for ICU nurses to return time to patients in the first hospital. We call it Hospital A. Actually, I shared this project in 2021 in Global Connection meeting. So the background is in that year, 7 nurses quitted. So the quit rate reached to 16% in 2018. And also you can know that in the ICU with 30 beds, the satisfaction decreasing and also the compliance increasing, and the safety and the quality may get worse. So in this situation, many people may think about it. If we need to solve this problem, we need to ask why. Yes, we need to ask why the nurses quitted. So they got the answer because the workload is too heavy. They have too much workload, too much burden. So how to reduce the burden, how to reduce the workload? Maybe some people may think, okay, we need to hire more nurses. But if we hire more nurses, yes, the workload can be shared by more people. But do we have that budget? No, the answer is no. So it actually cannot be solved by that regular method. So we need to think about it in a lean way. So that's what we did. We observed the nurses' daily work, and found that for the nurses, especially for the day shift, the walking distance for every nurse, every shift is around 15 kilometers. It's 24,000 steps a day shift within 2 hours. So that's a lot. You can see just for a regular an adult, the speed is around 5 kilometers per hour to walk. But for the nurse in this ICU, they have to walk 7.5 kilometers per hour. That's too much. So we go to observe what they have done and why they need to walk so much. And we use the talk time, we use the spaghetti chart, we use the value stream map, we use the kind of inventory management, and we use the visualized management to reduce the work of the nurse. Then the walking distance was reduced from the steps was reduced from 24,000 to 7,000 steps, and the time reduced from 126 minutes to 36 minutes. It means we save 90 minutes for each nurse in a day shift. So the nurse can have lower burden, and then they can give more time back to the patients and have a much better safety and quality in the ICU. And also the ICU patient hospital days were reduced from averagely 7.1 to 5.8 days, and patient satisfaction reached to 100% by the year. And also no nurse quitted in that year. So for this project, the key learning is that the people would like to try after he or she experienced the benefits of Lean. Witness, feel, then change. The ICU head nurse, Miss Song, got her aha moment by not adding more people, but reducing waste to solve problems, and started to apply Lean in other processes. This hospital management team was encouraged by the pilot project and accomplished the other 19 improvement projects to satisfy patients and the healthcare givers in 2019, and keep practice name from 2019 to date. That's the first project. And then the second project meets increasing demand in endoscopy center in Hospital B. Actually, I shared this project in 2022. So the GI department met a challenge of a high demand of painless endoscopy health checks in 2019. So the patients complained a lot about a long waiting appointment, more than 1 month. The doctors and nurses complained about long overtime work, but the CEO focused on the ROI. So they set a goal for the director of GI department. They need to increase the patient health check service from 100% to 180 cases per day in 1 year. So the director came up to a plan and to report to the CEO. So CEO, we can meet the goal in the next year, but we need investment with $4 million. The CEO refused him because they don't have the budget. So how can we do it? We also use LeanSync. We use LeanSync to reduce waste, to reduce something, not to add something. And you know that we cannot reduce the time to check for the patients. But because the check time is valuable, is value added to the patients, but the exchange time between two patients is not value added to the patients. So we go to Gemba and observe the process. We reduce the waste and we shorten the exchange time by averaging from 10 minutes to 5 minutes. So we improve the efficiency more than 80%. That allowed the number of patients each day increased from 100 to 186. So patient satisfaction increased from 92% to 99%, and the staff reduced overtime work 1 hour per day. Most important, the hospital revenue increased $2 million, and also got cost avoidance of $4 million. So $2 million plus $4 million minus, that's $6 million within this single project. So in this project, the team, when we discuss this, the key learnings about the project, they thought about we need to jump out of this zero-sum game. Her nurse received her own aha moment by the outcome with no additional equipment, with no additional doctors, with no additional nurses. This case also enhanced CEO's confidence in Lean healthcare strategy. So that's second. The third project is reduce waiting time for patients and healthcare staff in Hospital C. Actually, I shared this project in last year in 2023. So if you are interested in this project, you can go back to see the record or the sharing. So by that time in this hospital, they got around 3,000 beds, and many patients complained that it took too long to get blood drawing for all patients. Too many patients standing in the front of service window also gave lots of pressure to the staff. There were only 28% of the people need to wait to get the blood drawing within 10 minutes. That means more than 70% people need to wait more than 10 minutes. So usually, if we think about to add more people, add more windows to serve the patients, we need to increase our cost. But how can we reduce the waiting time without adding cost? That's the new way. So after analyzed with talk time, standardized work, visualize management, something like that, we found that we only need to shift, actually not only countermeasure, but the key countermeasure. The key countermeasure is to shift the work hours. We reduced 7 staff to 3 staff working hours at the time of 10:30, but we increased 2 staff to 4 staff at the time of 6:30 in the morning. So by this one, actually in total we got 4 working hours reduced per day. But the mean of waiting time has been improved from 1,000 seconds to around 700 seconds statistically. The median of waiting time has been improved from 1,000 seconds to around less than 600 seconds. That means less than 10 minutes. The percentage of patients within 10 minutes has been improved from 28% to 55% statistically. So when we think about it, people saw it, they can understand it that Lean Healthcare is not to advise hospital to ask caregivers to have more overtime, and also not to advise hospital to sacrifice safety, quality, and experience of patients, but to create value for patients more efficiently through eliminating waste with scientific methodology. So when people understand this, experience this, saw this, and they can feel it, it's really a different approach to manage hospitals. By that time, we will go to this step 2. So in the case 2 I shared previously, they told me, William, now we believe that Lean can be implemented in our hospital and can really help us. So when we go to step 2, we call it Lean departments. Actually, is to establish the Lean management system in a department level. We will select several panel departments to try this Lean management system to help them to engage all of the people in the department to participate in the continuous improvement. So to assess or evaluate the departments, we use 4 elements. The first one, we need to have a very good foundation of the understanding of Lean. So that means all staff in this department need to understand Lean principles. The second element is that they need to define their strategy metrics aligned with the strategy of the hospital. So they need to define that, and we need to see several key strategy metrics be improved significantly. This the second element. Third one is we need to see at least 3 typical A3 projects per year to show they have managed this scientific methodology very well. And then this fourth element, we need to see lots of rapid improvements with high participation. Let me show you an example. So actually last year, 2023, we helped a department, we call it outpatient department, in a hospital with 1,000 beds. So in this hospital, in 1 year, they finished rapid 199, almost 200 rapid improvements. This kind of rapid improvements is raised up by the frontline staff and implemented by them with the support from the directors and also the handlers. And then they defined 48 true north metrics for their own departments aligned with the strategy of the hospital. And then they finished 12 A3 projects within their own department aligned to those 48 true north metrics. And for all of these improvements, including rapid improvements and A3 projects, they got 97.3% of the people participated in this continuous improvement activities. That's what we talk about. And also the result, the score of our patients' satisfaction increased. The complaints of the patients decreased. And also the score of staff satisfaction increased a lot. You can see the chart. So when we tried these Lean departments in hospital, we have succeed in several pilot departments. Then we go to step 3. We help hospital to create lean hospital in the whole organization to create the continuous improvement culture. To align with the strategy of the hospital, we would like to see everywhere, everyone, every day, people can see problems, then eliminate waste to solve problem. So when we talk about and also we can give you an example. The hospital named Zhejiang Taizhou Enze Medical Center is a state-owned public hospital with around 3,000 beds. So they started continuous improvement around 20 years ago, and they started lean healthcare in more than 10 years ago systemically, and they won the China Quality Award in 2019, just 5 years ago. So China Quality Award is the highest quality award in China. And also right now, this hospital is the first hospital and also the only hospital to win this China Quality Award in healthcare industry. So I have shared the 3 steps. What is it actually? Actually, what I would like to share with you is the path of lean healthcare based on change management. So that's our experience during the past years to help Chinese hospitals to implementing lean. So the first step is to do improvement projects. Maybe some people may say, okay, projects is about lean is about transformation, something like that. But as a start, we help people to do improvement projects to help them to see the result and then to help them to change the behavior, change the culture is very important. And then we go to the lean departments to help the department level to establish the lean management system. Also, it's pilot departments, and then we go to the lean hospital. So with this path, with this path from improvement projects to lean departments and then in hospital, during the past years, we got 1 training center in Shenzhen in China, and also we coached 25 hospitals, and we trained more than 2,400 green belt trainees, and we helped more than 50 million outpatients to benefit from our lean improvements in different area all around China. You can see the map I showed in this slide. So that's how I would like to share with you. Any questions? So you can type in question or I can share with you my email. If you can also contact me directly. The book below my email actually is written by me. The English name is Lean Healthcare: How to Implement Lean Chinese Hospital. Actually, it's talking about how to improve patient service, improve quality, medical quality, and operational efficiency of the hospital. So if you are interested in translating this book into your own language, just contact me. Okay.
William, we got one question. Are the improvements structured around A3 documents, or what are the favorite tools used?
Actually, the A3 is the key tools used in the hospitals. And in the A3, we may use also ValueStream Map, we use Talk Time, we use 5 Whys, some tools like that. So we kind of organized all the different tools into an S3 to follow the scientific problem-solving methodology steps.
Yeah, so the S3 is the main tools, right?
Yeah.
Okay, thank you very much. Time's up. If we got William's email, if you have any questions, please send your note. Don't hesitate to send a note to William. Thank you.
Thank you.
Bye.
Bye-bye.